COVID-19 vaccines are available in every corner of the country, but questions still remain about how effective they are against new variants and how long their protection against the coronavirus will last. Good evening and welcome to this month's edition of Rural America Live with AARP. I'm Christina Loren. We also welcome our listeners joining us tonight on Rural Radio Sirius XM Channel 147, and you are a big part of this show. We invite you to join our conversation tonight. Our phone lines are open now. Give us a call at 877-283-7570. And our question of the month is, what question or comment do you have about the COVID-19 vaccine? We look forward to hearing from you tonight, and 5 lucky on-air callers will win a Yeti cooler tonight. If you're caller number 2, 4, 6, 8, or 10, you will be a winner. And we want you to join our conversation, 877-283-7570. Remember, you don't have to be a member of AARP or over the age of 50 to win. As a friendly reminder, you can only win one time each calendar year. And if you are a winner tonight, AARP will call you back using the number you called from in the next few days to confirm your mailing address. Now, if you're a past winner or if you haven't received your cooler, be sure to return their call and provide a shipping address. Just a little side note, because of the pandemic, it's actually slowed down the shipping of coolers, but your cooler, your Yeti cooler, will arrive. So good luck to you tonight. And joining us from AARP, Sarah Jennings, Regional Director, joins us from Sioux Falls, South Dakota. And our special guest tonight, Dr. David Aronoff, the Director of Infectious Diseases at Vanderbilt University Medical Center. We welcome you both. Let's get right into this conversation. Dr. Aronoff, tell us a little bit about you and your rural upbringing to start.
Well, thank you very much for having me on. I grew up in rural Indiana. I'm the child of parents who grew up in rural Illinois. My mom was raised on a big farm with animals and lots of corn and soybeans, and I spent a lot of my childhood visiting my grandparents running through the corn. Ah,
that is wonderful. So you can definitely relate to rural America and some of the challenges that rural Americans have faced throughout this pandemic, which is why it's great to have you on tonight. Tell us about how Vanderbilt University Medical Center became a major player in getting the Moderna vaccine ready for distribution.
Well, thank you for asking that question. We've had experts studying coronaviruses at Vanderbilt for over 3 decades. And when this need arrived and we knew that we needed vaccines, we very early started small clinical trials of the Moderna vaccine to make sure that it was safe. We call these phase 1 and phase 2 studies. Those were critical to showing that the vaccines may unlock the answer to getting this pandemic behind us.
Oh boy, we sure want to put it behind us. We want the American economy to get back on track. We want our friends and relatives to be healthy. So that's why we're talking about the vaccine tonight. And the Queen of Nashville, Dolly Parton, actually helped you out in your efforts. Tell us about that.
We are so thankful for Dolly Parton. I tell you, she has really done so much for so many people. And with money that she contributed to Vanderbilt, we were able to finance these small studies of the Moderna vaccine, which led to the very big studies, and also studies of something called convalescent plasma that's being used to treat people with COVID-19. So we will always be so thankful for Dolly Parton in helping with these efforts.
Oh, you gotta love Dolly. Dolly just does everything right. She is such a wonderful giver in this community. I really appreciate you bringing that up. Sarah Jennings, long time no see. AARP has been working hard to get the right information out to folks in every state. Tell us about the efforts underway and the type of information that you've compiled and made it really easy for people to access.
That's right. You know, AARP, we're lucky because we actually have staff and volunteers in every state. And so as the vaccine started to roll out in December and January, what we heard from members and from the public in general was so much confusion about how do I get a vaccine? Where do I get one? Should I get one? And all of the different questions that were going through people's minds. So what we did was we created a resource for every single state. We have at aarp.org/vaccine info, and you're seeing it there on the screen. You go to that website and then you can put in your state. And then it takes you to very state-specific information about the vaccine, you know, where you can get one, how you can sign up. For a while there were a lot of limitations across the country about who was eligible. And so we had all that information there. And so it's just a great page that if you're wondering still about kind of how things are going in your state, check out that website. There's a ton of great information there. The second thing that we did across the country was we really worked with local and state officials because, again, the rules were so different across the country and even from county to county, community to community. And so one thing we tried to do, again, was to sort through and really advise local and state governments about how they could do the best job possible in getting information out about how to get vaccine and then to actually help get shots into arms. And I was really proud because if you look early on at some of the states that did the best job, it was actually a ton of states with very rural populations. And I think that was a testament to rural America. We sort of know how to get things done. And we leveraged a lot of the existing relationships between community pharmacies and doctors and those sorts of things. And so that was something that, again, AARP really partnered with all those organizations to try to get access to our members. For those who wanted a vaccine, we wanted to make sure they could get one. And then lastly, we created a coronavirus resource center that is, again, another website for people who are comfortable going on website. And at this website, there's a lot of information about staying healthy and mental health and travel tips and a lot of myths that have been out there about the vaccine and the coronavirus in general. So there's just a lot of information there. And so I encourage people to go check it out. And I hope that you would find that if you have a question, we've got an answer.
Thank you. Thank you to you and AARP for providing rural Americans with solid information that's easily accessible, all in one place. Nobody else is doing that like I've seen AARP. I really recommend you check out that website. Dr. Aronoff, let's talk a little bit more about the vaccines and some common questions that people have about the vaccines right now. Let's start with the new guidance regarding fully vaccinated individuals and masks. This is a little tricky here because if someone is vaccinated, they're wondering in some cases, why do I still need to wear a mask on an airplane, for instance?
Yeah, that's a really common and excellent question. First of all, it's important to know that vaccines do make it very hard to get infected, but they don't make it impossible to get infected. And if someone who's vaccinated does happen to get infected, they're less likely to spread the virus to other people. But when we're on confined small spaces, think of buses and train cars and airplanes, it's really important in those crowded situations to protect one another, even when the chances that someone who's vaccinated participates in transmission is very small. We want to make that risk even smaller. And so we ask everybody on an airplane, while disease is still spreading, to wear a mask.
I guess it really comes down to, are we talking about vaccinated individuals being of relatively low risk or no risk?
Yeah, it's a really important question. And the answer is that vaccines need to make it hard to get infected, but vaccines are not perfect force fields. If I'm vaccinated, I could still get infected. It's harder for me to get infected. I may have to inhale a pretty big dose of virus to get infected, but it's still possible. What the vaccine gives us is the protection to know that we're less likely to develop symptoms if we get infected. We're much less likely to get sick or end up in the hospital or worse. And if we get infected, we're going to clear the infection quicker, we're going to shed less virus, and that means we're less contagious. And so vaccinated people are much less likely to participate in the chain of transmission that is keeping this pandemic alive.
But it doesn't mean you are invincible. And with these variants now becoming more and more common, especially in India, now they're coming over here, what are your greatest concerns regarding COVID-19 right now?
Well, the number one concern is to get people immunized. These vaccines have been now given in hundreds of millions of people in the United States and billions of people around the world. And they've proven to be very safe and very effective. But we really need to get people immunized so that we can stop the spread even of these variants, which fortunately the vaccines we're using today do protect against the variants that we're seeing today in the United States.
If you can, just give us a little bit of a brush up on the variants. Which are you most concerned about, and which of the variants is most widespread in here in the United States right now?
Right, so we've been tracking variants around the world, and we do that by scientific studies of the viruses, and we all heard about a variant that came out of the United Kingdom Kingdom called the UK variant. That's currently the most common variant in the United States. The variant in India is working its way outside of India. It is currently the most common variant in the United Kingdom, and we're starting to see it here in the US. We're seeing variants from Brazil, and even variants from New York and California are circulating. The vaccines work against these, but we need to get people immunized to stop the spread of any of these variants.
Yeah, to stop the losses. I mean, so many people know somebody at this point who has been impacted by COVID-19 in a big way, and it's really, really hard that these stories keep unfolding. We still hear about people getting the virus, so we're not done with it yet. Sarah, what are you hearing from your members in your region? What type of questions do they have about vaccines and the virus itself?
Yeah, I think the good news for a lot of our members and the 50 plus in general is that the questions have gone from how do I get the vaccine to now that I'm vaccinated, what can I do? And I think we're all having that post-vaccination anxiety about, is it really safe to go hug my grandkids or go to the grocery store and all of those things. So I think those are the questions that we're hearing the most right now. It's really just people trying to figure out what they're comfortable with as they sort of, I guess, re-enter society after the last 15 months of probably being much more isolated than they're kind of used to. So those are probably the big questions. Of course, there's still some, folks who have questions about whether they should get vaccinated and questions about the vaccine. And so I do think that tonight's show is wonderful because people can ask more of those questions and, get reassurance or get more information to make that decision about whether or not to get vaccinated.
Yeah, you're absolutely right. Capacity restrictions being lifted in many major states, and so a lot of people will be venturing out. It is important information. We are going to take a quick break. The phones are open, though. We want to hear from you tonight. Join our conversation. What questions do you have about the vaccine? Maybe you know a doctor or a farmer, any essential worker who deserves a nice shout out for all they've done throughout the pandemic. Let us know. Give us a call at 877-283-7570. And we are giving away 5 Yeti coolers tonight. You could be a lucky winner. We'll be right back with more Rural America Live with AARP after this.
Well, hey, it's me. I'm finally going to get my vaccine. I'm so excited. I've been waiting a while. I'm old enough to get it, and I'm smart enough to get it. So I'm very happy that I'm going to get my Moderna shot today. And I wanted to tell everybody, I think you should get out there and do it too. I even changed one of my songs to fit the occasion. It goes, vaccine, 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 vaccine. I'm begging of you, please don't hesitate. Vaccine, 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 vaccine. Because once you're dead, then that's a bit too late. I know I'm trying to be funny now, but I'm dead serious about the vaccine. I think we all want to get back to normal, whatever that is, and that would be a great shot in the arm, wouldn't it, if we could get back to that. But anyhow, I just wanted to encourage everybody, because the sooner we get to feeling better, the sooner we are going to get back to being normal. So I just want to say to all of you cowards out there, don't be such a chicken squat. Get out there and get shot.
Gift cards are popular and convenient, and not just as gifts. Con artists have latched onto them as an easy and untraceable way to steal your money. Here's what you need to know about gift card payment scams. If you are contacted about an urgent financial matter and told the quickest way to address the issue is to buy 1 or more gift cards, it's a scam. The criminal will ask you to share the numbers on the back of the card, but once that happens, the fraudster has your money instantly. Scammers may refer to gift cards as electronic vouchers, but make no mistake, legitimate businesses will never ask you to pay a fee or debt by purchasing a gift card. It's best to disengage immediately and report the interaction to the AARP Fraud Watch helpline at 877-908-3360. For more about gift card payment scams, go to aarp.org/giftcards.
Always looking out for you, AARP. Welcome back to Rural America Live with AARP. Tonight we are having an honest conversation about vaccines, and we want to hear from you. We're taking your calls, answering your questions, or maybe you have a comment or a shout out for somebody who has been serving throughout the pandemic. They've gone to work each and every day. even in the uncertainty. Tonight, to help us talk about vaccines, AARP Regional Director Sarah Jennings joins us from Sioux Falls, South Dakota. And here in studio, we have Dr. David Aronoff. He is the Director of Infectious Diseases at Vanderbilt University. So you know that's a tough position to fill, especially in a pandemic. He's a man who knows exactly what he's talking about. And just to add a little sugar on top, we're giving away 5 Yeti coolers. We want to hear from you. If you are caller number 2, 4, 6, 8, or 10, you will be a winner tonight. Give us a call at 877-283-7570. We have 5 coolers to give away starting. We're going to start taking calls now. Marie from Texas joins the conversation. Thanks for joining us, Mary. Go right ahead.
Yes, my question is, even although people have taken the fully vaccinated, what's the percentage that they won't get the virus? If it's a 90% or it's just an experimental vaccine?
Yeah, that's a great question, Mary. Thank you for asking that. So the vaccines, once people have had 2 doses of these vaccines, they are highly protected. And when we saw the data from the large clinical studies that enrolled tens of thousands of people and compared the 2-dose vaccines to a placebo, basically a saltwater injection, it was very clear that the vaccines protected around 95% against getting symptomatic COVID. Since the trials have concluded and these vaccines are in common use, they're now no longer considered experimental and have been given literally to hundreds of millions of people. We're seeing the same level of effectiveness in the real world. Over 90% effective at preventing symptomatic COVID-19. So these are real, they're safe, they're working really well, and they're doing exactly what we need them to do to get this pandemic behind us.
All right, that leaves a line open for you tonight. 877-283-7570 is the number to call. We have our first winner tonight, Jim from Montana. Congratulations. Go right ahead.
Good evening. My question is, I know this is new to all of us, but what do we know about the longevity of the vaccination? Is there any understanding of a month, 6 months, a year, forever?
Yeah, Jim, that's a really important question. It's on all of our minds. And so far, we're basically waiting for data to come out month over month. And the vaccines have now been used since roughly December or so. But even dating back to the clinical trials, it looks like people have very robust antibody or immune responses that are lasting at least 8 months. Probably longer. The levels of antibody we get in our blood as a result of 2 doses of these mRNA vaccines are really high. And I think that immunity is going to last on the order of a year or more, but we still need to do the studies to be sure.
All right. Congratulations again to you, Jim. Thank you for that call. We're going to go to North Carolina now. Tammy joins the conversation. Go right ahead, Tammy.
Hey there. I was wondering, I am scheduled to get my second Moderna shot on Tuesday, this coming Tuesday. And everybody has told me, oh, wait till the second shot. And I'm really not wanting to dread it because I didn't have hardly any side effects from the first one other than a little soreness. And I'm just, wanting to know, are there things I can do in advance? Because some people are saying, you need to rest probably the entire next day, and missing work is a concern for people. So I was just wondering, are there precautions, or not really precautions, but things I can do in advance to try to minimize that?
Tammy, thank you so much for that question. It's really common. First of all, you can have a really strong immune response to the vaccine and not feel under the weather. So it may very well be that your second shot leaves you feeling the same way that your first one did. But because the purpose of the second shot is to give your immune system a boost, you may have more symptoms the next go round, and that could include fatigue or body aches or fevers. And so I certainly recommend you get hydrated before you get your vaccine. You do prepare for feeling a bit under the weather the next day. Usually it pops up the next day and can last a day or two. But medications like acetaminophen, that goes by the brand name Tylenol, or medicines like ibuprofen, that you would normally turn to, or if you were feeling achy or feverish, those are perfectly safe to use as long as it's okay with your licensed healthcare professional for you to be using medicines like that. That can be a great way to make those symptoms resolve. But I really thank you for your question and am very thankful that you're getting vaccinated.
Yeah, thank you.
Well, if I could jump in, Christina, I just have to say, Tammy, I got the Moderna and I did have more symptoms after the second shot, but they go away quickly. So brace yourself. Maybe you will, maybe you won't, but it's good to be prepared. And just know if you do feel a little crummy, it's, you feel fine by the next morning. So it wasn't anything too awful. And I just and I slept a little bit more than normal that day and had some aches, so it wasn't too bad. And it does sound like everybody's different. So hopefully you won't have any effects at all. But if you do, just know that they pass quickly.
Thank you for that, Sarah. Talk a little bit about how the state officers, just like you, they have been out there and they've been working throughout the pandemic trying to help out their local communities, especially with information and many other items as well. Tell us about what's been going on.
Yeah, I think what's been really rewarding about this challenge of the vaccine and trying to make sure people had access was that ARP offices across the country were in a great position to work with local and county, state governments, other partner organizations to identify what were barriers for people who wanted to get the vaccine but couldn't. And so, for example, in Oklahoma, our state office there worked with some rural transportation providers to give them some small grants to make sure that people in rural Oklahoma could get to their shot if they wanted to get there. Or in Tennessee, we had volunteers calling all over the state to help connect people to vaccine appointments and just to answer questions or connect to people, people who just had questions and didn't know who to ask. We had our volunteers calling and connecting them to information. And we had things like that happening all over the country, and really just trying to use our connections, we have lots of ways we can talk to our members, and just trying to use all of those things in a helpful way during this this effort. And it was something like nothing we've ever done before, but it's been really rewarding. And there is, there's just people have so many questions. This has been such a personal decision in terms of getting vaccinated, and just want to make sure people feel really informed. And I think we've done as best as we could, and I think we've helped a lot of people.
Oh, absolutely. You still are. You still are every single day having all those resources available and doing this show. We have another winner joining us on the phone. Jerry from Missouri joins the conversation now. Congratulations, Jerry. You're the new owner of a Yeti cooler. Go right ahead.
Thank you for that. I'm just calling on, my question is, these booster shots that we may have to take in the next year or so, is that going to be a yearly thing like a flu shot now? Or how is that supposed to be working? Or is there any truth to it at all?
Yeah, Jerry, that's such a great question because it's on everybody's mind. Are we going to be going through getting shots every year or not? The short answer is we don't yet really know. It does depend on the disease activity around the world and whether it's coming back to the United States next year or 2 years from now, and whether there are different variants of the SARS-CoV-2 virus in circulation that may benefit from a more targeted vaccine. Certainly, if we could avoid repeating the last 15 months by getting a booster each year, I would be first in line, since the last 15 months has been so devastating to our economy and to our population. But we just don't know yet. I think it's a little early to know if we're going to need boosters every year, or maybe in 2 years we'll need one and then not need one after that.
All right. We are really making the rounds tonight. Michigan this time to speak with Kelly. Thanks for joining the conversation. Go right ahead, Kelly.
Hi, my question is people with autoimmune like myself, I take an injection every Friday. And with the vaccine, how does that medicine counteract with each other, or is it safe? How do you know that it is? And because I was told that it hasn't been out long enough, the COVID vaccine hasn't been out long enough to even know the answer to that. But I haven't gotten a shot yet because I was advised not to because of my autoimmune. So I'm waiting.
Yeah, Kelly, thank you for asking that question. Anybody who has a medical condition and who has concerns about getting vaccine should absolutely have conversations with your licensed healthcare professional to make sure that there aren't any concerns. So far, widespread use of the COVID vaccines, including the 2-shot mRNA vaccines, are showing to be quite safe and effective even in people with autoimmune disease. But if people are on medicines that reduce the strength of their immune system, medicines like steroids or other medications that weaken their immune system, they may not get a robust or strong response to the vaccine. And that could mean that somebody who's not getting a really strong response to the vaccine still needs to be careful and take precautions while disease activity is still high in their area, socially distancing, wearing masks. And that's why I think it is really important to have an open conversation with your licensed healthcare professional to make sure that you have a great plan for getting vaccinated and doing everything to keep yourself and your loved ones safe.
All right. Thank you so much for that call. We appreciate it. That leaves a line open for you tonight. The number is 877-283-7570. What questions do you have about the vaccine? Or maybe, like Sarah, you've already been vaccinated and you can share your experience with us so we can learn more about what you went through. We can all learn from each other as we go through this together. 877-283-7570. Our next caller is a winner. Dana from Wisconsin. Thanks for joining us. Go right ahead. Okay. So we're going to go to Maurice in Alabama. Thanks for joining the conversation, Maurice. Go right ahead.
Well, I've had the vaccine, and I'm joyful about it. But my sister has not, and she has, I don't know, she believes all kinds of odd things about vaccines in general. And she thinks there's a chip in it. And I just wonder what I could say to help encourage her to get the vaccine.
Maurice, thank you for asking that question, because that brings up some common challenges that we're facing in public health and for me in infectious disease of convincing people not only is it important that we protect ourselves and we protect others by getting vaccinated against this virus that causes COVID-19, but that we really understand what is true about the vaccines and what's false and what are some myths about the vaccines. I can tell you that the vaccines don't have any kind of microchip in them. They are not tracking devices. These are simply vaccines that train our immune system to make our own natural antibodies that prevent infection or protect us from getting really sick with COVID-19 and make it very hard, if we get infected, to spread the infection to others. Clearly, I and my colleagues have a lot of work to do to continue to help people to dispel myths and get over any anxieties that are out there. And that's why I'm really happy, Maurice, that you shared that story, because it really just reemphasizes that we still have a lot of work to do. And everyone like you who's willing to get a vaccine and show leadership to their families and communities helps even more than a talking head like me. So thank you so much.
Yeah, we sure appreciate that, Maurice. Thank you. We're going to go to Iowa, another brand new state, to speak with Suzanne. Thanks for joining the conversation, Suzanne. Go right ahead.
Yes, we're anxiously awaiting to see our daughter and son-in-law from Nashville, Tennessee, in another week. They had the virus in February. They've both been vaccinated with the Johnson vaccine. My husband is 84. I'm 80. We've had both Moderna shots, and then we have 2 great-grandchildren that will be visiting us on the farm. The one great-grandson has had both shots, and our great-granddaughter will have had one of the shots when they get here. So this is a big farmhouse. What precautions do I need to do? They'll be staying around here for a week. So I guess I'm the first one that's mentioned, someone 12 and older with the shot.
Yeah. First of all, it's great to hear that you have family here in Nashville. And it's also great to hear that you and your family are getting immunized and that adolescents in your family are getting immunized now that we're able to vaccinate people 12 years of age and older. It sounds like you're doing all the right things. of course, as different households get together, when you're vaccinated, you can be together and you don't have to be wearing masks. I would probably tell any family member that's going to come and visit me to make sure that if they're having symptoms or are exposed to someone with COVID-19, that they maybe delay their trip. But it sounds like that's not the case. And even with a single shot, given that the rest of the family has completed their vaccine schedule, I would be comfortable with the plans that you've made. And I appreciate that question because this is becoming more and more a common scenario.
With the vaccine hesitation that we do hear about, there are a lot of people who are still skeptical about actually getting the vaccine. Are we still on our way to potentially reaching herd immunity? Is that going to happen now? What are your thoughts there?
Yeah, well, we really do want to get more than 70% of the population immunized. And we're almost at 50% in the United States, which is great. We were vaccinating at a clip of over 3 million doses a day. And unfortunately, that's dropped off, and we're now less than 2 million doses a day, which is still a lot, but I know that we can do better. And so the quicker we can get to having as many people vaccinated, over 70% as possible, the more likely we are to get to this phenomenon called herd immunity.
Right now, it seems like the supply is exceeding demand in a big way. What can we do to relieve some of that vaccine hesitation amongst the people that we know, our family members, our friends? Because after all, we want to look out for one another. We want to dispel the myths and really look at sound science. But how can you do that if you're just a regular individual like myself and not a doctor?
Well, everybody plays an important role, and I like to really emphasize that this isn't complicated and we should keep it simple. The vaccines protect us as individuals. They make it so that we're less likely to get infected. And if we're vaccinated and get infected, we're much less likely to have symptoms. We're less likely to end up hospitalized or worse, like dying from infection. And for those people who are young and healthy and think, I can't get sick from COVID-19, so I don't need to get protected by a vaccine, what I would say is actually young, healthy people not infrequently lose their sense of taste or smell with COVID-19. And that can be very disturbing to a quality of life, and it can last for months. Also, people can get problems like brain fog that makes it very difficult to do your job or to concentrate and can really be harmful. And of course, every once in a while, someone who's young and healthy really does badly with COVID-19. So first and foremost, it's about protecting yourself. But the second thing is that if you're vaccinated, it is harder to get infected and harder to spread the virus. And that means you're creating what I like to say is a human shield that protects the people around you. And that is really the most important way that we're protecting the people we care about, the people we work with, the people we go to school with, is by participating in blocking the ability of the virus to go from person to person. So a really selfless thing an individual can do is to get vaccinated, and while they're protecting themselves, they're also protecting lots and lots of other people.
You mentioned that brain fog. I work with Dr. Gold from the University of Nebraska Medical Center. He actually brought up the fact that some people, after getting vaccinated, some of those lingering effects, like the brain fog, will actually go away from people who previously had COVID-19. Have you heard about that?
Yeah, we are hearing stories of what has been described as long hauler syndrome or post-COVID symptoms improving with vaccination. I think there's still a lot that we have to learn about that, but that is one of those potential benefits that we're eager to hear about, because COVID is clearly leaving some people debilitated and really harming the quality of life. And that is a big reason to get immunized.
Absolutely. All right. Winner, we have Tom from West Virginia joining us. Thanks for joining us, Tom. Go right ahead.
Woohoo. Hey, thank you. I'm getting a cooler, huh?
Oh, you're getting a cooler. Yeti cooler.
All right. Okay, so I got a couple of questions. One, never had a flu shot. I spent my youth shooting rats at a dump in Foxborough, Massachusetts during the summertime, digging through trash. So my immune system is very good. However, 2 open heart surgeries, I have coronary artery disease. I have not been vaccinated. I was going to go with the Johnson & Johnson until I heard about the blood clots. So what is the latest on the Johnson & Johnson vaccine? Is it being administered now or not?
Yes, Tom, thank you for calling, and you sound like a really interesting person. Really appreciate you calling. Your question is so good. First of all, it's important to remember that COVID-19 is more dangerous to people than influenza. That has really proven to be the case throughout this pandemic, and people with cardiac disease or high blood pressure or diabetes are at increased risk for really doing badly with COVID-19. The Johnson & Johnson vaccine is very safe and very effective. We have heard of very rare cases of severe blood clots and low platelets. With a lot of surveillance across the United States, there have been 30 of such cases out of nearly 10 million doses of the vaccine, so about 3 cases per 1 million recipients of the vaccine, and the risk seems to be higher, although still quite low, in what we would say women of reproductive age, sort of between ages 18 and 49. So absolutely, it's a really good 1-dose vaccine. It is currently in use in the United States. And Tom, I really thank you for bringing up that question.
Yeah, great question. And that leaves a line open for you, 877-283-7570. We are going to come back right after a quick break, and we still have a Yeti cooler to give away. It could be yours. Give us a call and number on your screen, 877-283-7570. Maybe you have a question about a vaccine or an experience to share, or maybe you want to shout out an essential worker tonight. We're going to give you the opportunity to do so. 877-283-7570. More Rural America Live with AARP right after this.
We're the Oak Ridge Boys, and you're watching AARP Live.
Yeah.
Love those Oak Ridge Boys. Welcome back. We have callers on the line waiting to ask their questions, and we still have a Yeti cooler to give away, so let's not waste any time. Go right to the phones. And Ma joins us from Maine tonight. Thanks for joining us, Ma. Go right ahead.
Hello.
Hello, Ma. Do you have a question or a comment?
Question.
Go right ahead.
I'm turning 80 next month, and I don't have a vehicle to get around. I live alone on 88 acres of land, so I live by myself. And I call the hospital, and they want me to get on a website. Well, I don't have a computer, so I can't do that. So I'm stuck. And the Johnson & Johnson would be the best shot because I'd only have to make one trip. Just wondering how I could finagle it.
Well, I would jump in and say that maybe if we could get, and I don't know if our screeners can still hear, but if we could get Ma's information, I think our state office might be able to reach out and see exactly where he is in Maine and kind of some of the opportunities available. We heard it a lot in the early days, and sorry if folks can hear the plane going overhead. We heard a lot in the early days about there were so many states and counties that only had a website, so we pushed hard for phone numbers to be available for people to make appointments. But even if you get an appointment, I know sometimes getting to the appointment's rough too. So that would be I hope that we can help you out with the state office up there in Maine. They're a great team. And we'll try to get your information, and someone will give you a buzz back in the next couple of days.
We love our AARP state officers. It's fantastic that you can facilitate that. Really appreciate what you're doing at AARP just for that reason alone. You know, we have another caller, and our caller is a winner. We welcome John from Minnesota to the conversation. Thanks for joining us, John. Go right ahead.
Yeah, I just want to say the vaccine has helped open up America, and it has helped everybody. And I salute all the doctors, and I salute one in particular, Jared Reese. He's my family doctor.
Well, we tip our hat to Mr. Reese tonight. Love hearing that. Don't you enjoy hearing comments like that?
I really love it. And I'm so thankful for so many different people. I'm thankful for the residents at our hospital, the frontline workers, the ambulance drivers, the nurses. I mean, everybody's really been focused on helping people during this pandemic. And now my thanks is really turning to people who aren't in healthcare, who are stepping up, getting vaccinated and protecting all of us. And really, that's what we're here to talk about tonight, and I'm very excited about that.
Yeah, absolutely. Okay, 877-283-7570 is the number to call and join our conversation tonight. Maybe you have a question about a vaccine that you can't get off your mind. Well, it's a perfect opportunity to ask an infectious disease expert. In fact, from Vanderbilt University, it doesn't get much higher than that. We're going to go back to the phones and talk to Pat from Georgia. Thanks for joining us, Pat. Go right ahead.
Yes, I have a couple questions. One is on you. There's a rumors going around about Ivermectin helping to either prevent it or at least treat the virus. And then the other question is about vitamins, the regimen of vitamins that doctors are putting you on once you've been diagnosed or you've been taken to prevent COVID. I was just wondering if you have any comments on those.
Pat, thank you for your call. Your question is really a common one and a very good one about medications that can be used that may help people who have COVID-19. Currently in the hospital setting, we're using antiviral drugs. One is called remdesivir, which does seem to help people get better quicker with COVID-19. And we use fairly inexpensive corticosteroid drugs like dexamethasone in people who are hospitalized and requiring oxygen, and that's actually been shown to save lives of people with COVID-19. And there are a few other fancier anti-inflammatory drugs that we're using in the hospital. Outside of the hospital, we're using monoclonal antibodies. And these cocktails that you've probably heard about on the news are really effective at keeping people who are at high risk of getting hospitalized out of the hospital and keeping them safe. Medications like ivermectin or previously hydroxychloroquine or even vitamins like vitamin C and vitamin D and zinc, many of them are still in clinical studies to see if they're helpful, but so far there's no convincing evidence that they are helpful in COVID-19. In fact, hydroxychloroquine went through a series of really good studies that showed that it just didn't help prevent or treat COVID-19, and we're waiting for more data when it comes to things like vitamins and ivermectin. So your question is really good, and it points to the fact that we're always looking for solutions to a deadly virus and doing lots of very high quality studies to see which ones make the cut and are actually helping and which ones seem to be not effective. So thank you very much for your question.
Yeah, we appreciate that. Rick from Indiana joins the conversation now. Thanks for joining us, Rick. Go right ahead.
Thank you. I was just curious if you've been tested positive for COVID-19. Does the vaccine help? And if it does, how?
Rick, thank you for asking that question, and also thank you for representing my home state of Indiana. So your question is great, which is, if I've had COVID-19, am I protected from getting reinfected? And people who have had COVID-19 do seem to have protection against getting reinfected that lasts probably 6 to 8 months at least. The issue is that not everybody who's had COVID-19 has that protection, particularly people who were never symptomatic or very mildly symptomatic. Their immune response to that infection may have been fairly weak and not long lasting. And so we're really asking people who have recovered from COVID to give their immune system a boost, a strong boost with these vaccines. And the advantage to that, Rick, is that the vaccines train your immune system and boost your immune system to make high levels of antibody that's directed against an important part of the virus. This virus is covered with something you may have heard about called a spike protein, and it really does look under the microscope like little spikes that come out of the virus. And those spikes are like the Velcro that virus uses to stick to our cells and cause infection. And when we make lots of antibodies against those spike proteins, then if we get exposed to the virus, those antibodies bind to the spike protein, they block the virus from sticking to us, just like smearing petroleum jelly on Velcro. It loses its stickiness. And that's what those antibodies do. They prevent the virus from sticking to us and causing infection. And we know with these vaccines, you get a very strong immune protection that is even stronger than if you had been infected in the past. So we really are asking people to get a vaccine once they've recovered from COVID-19. Great question, and I appreciate you asking it.
877-283-7570 is the number to call with your question. We talked a little bit about the protection if you've had COVID-19 and recovered on your own, but do we have any more information about how long the protection will last with the Moderna vaccine, for example?
Yeah, that's a great question. How long are we going to be protected? And right now it looks like many, many months, because that's as long as these vaccines have been out. As we continue to monitor the people who got the Moderna vaccine in the clinical studies, their antibody levels are still really high, and that's encouraging. And so I'm anticipating that those vaccines will last at least a year.
Great.
What we hope is that we don't see new variants come on the scene that work around those vaccines. So far, that's not the case, but we're keeping our fingers crossed and asking everybody to step up, get vaccinated, and let's stop this virus in its tracks.
Wow, because it is a possibility. We still have to watch these variants. The mutations need to be watched very closely. Very interesting. We're going to go to Wisconsin. Beth Ann joins the conversation. Thanks for joining us, Beth Ann. Go right ahead. Okay, I think we may have lost her. But Sarah, I think this is a good opportunity to bring you back into the conversation as well, because you have that list of resources for everybody who's watching tonight. I'm sure that they have questions, they're looking for more information. Can you just refresh us on how we can find those?
Absolutely. So you can find your state resource guides at aarp.org/vaccine info. And also there's a website on your screen right now that you can also go to, which is aarp.org/AARP Live, and we'll have links to everything there. But that state-specific website that has lots of information about the vaccine in your state is aarp.org/vaccine info. And then the other resource we have is a Coronavirus Resource Center, which has information that's kind of applicable to everybody about travel and what's safe and things you can do to keep your mental health in check during this tough time. So that's another resource we have. So we hope people will use it. And I know everybody doesn't love going on the internet, but if you're comfortable going there, there's a lot of great information available.
Absolutely, especially one more time, aarp.org/AARP Live. You're going to find a lot of information and ways that you can access fraud watch information. They have it all compiled for you. It's a really great website. Mitchell from Iowa joins the conversation now. Thanks for joining us, Mitchell. Go right ahead. I think Mitchell might have his TV on. Can you hear me, Mitchell?
Yeah.
Go ahead with your question, sir. All right, well, I think we lost Mitchell. That leaves me an opportunity for a question. I want to ask about vaccine hesitation. Are you seeing an improvement? Are you seeing any change there? Is the needle moving, or do you think that this is something that's going to become more of a problem going forward?
No, I really do think the needle is moving, and part of it is by doing exactly what we're doing tonight, which is directly addressing people's concerns, their anxieties, their questions. We know these vaccines are safe, and we know they're really effective, but the fact that I know that isn't as helpful as helping the general public understand their role that they play. So, we have seen a little bit of a slowdown in vaccine uptake, but fortunately, people who are tuning in today know that it's really important, it's really safe and effective, and I think we just keep pressing the message that this pandemic is not over. It's important to remember that in the United States, over 600,000 lives have been lost from COVID-19. If we could have had these vaccines in 2019 in anticipation of this pandemic, those lives would not have been lost from COVID-19. And I don't want to see another person in the hospital. I round every day on our patients with COVID-19. It's heartbreaking. And I want to see fewer and fewer people in the hospital and more people celebrating life and getting back to normal.
You didn't hear a lot about vaccine hesitation when it came to polio. You didn't hear about it. People went and did what they needed to do to protect themselves and to protect others. So it's very interesting the times that we live in, but it is what it is. I want to bring in our next caller. Jim from Missouri is joining us now. Go right ahead, Jim.
Thank you very much for taking my question. And here it is. We're planning a business meeting of about 8 volunteers. And these volunteers, the vast majority have been vaccinated, but I believe 1 or 2 of the people have not been. What do we need to do to make sure to keep everybody safe in that situation? In particular, the people who have been vaccinated, but we want to keep everybody safe. Thank you very much.
Yeah, Jim, that's a really, really important question. And as we know from new guidance from the CDC, once we're vaccinated, we can be together without wearing masks, for example, and without paying really close attention to how many feet are between ourselves and others. When we're thinking about a gathering between small groups of people where most of the people are vaccinated, but a very small number of people are unvaccinated, as long as those individuals do not have risk factors for doing poorly with COVID-19, things like age over 65 or having diabetes, obesity, high blood pressure, etc., if they are not in a risk category, then it's okay to be with each other without masks on. What I would say, if you have the opportunity, first of all, try to offer vaccinations to all of the people who would be in that group of 8 people. But if there are 1 or 2 people who are not vaccinated, maybe you can arrange for them to get tested for COVID-19 prior to your meeting. And if they test negative and they haven't been around somebody who has COVID-19, then you may be on good footing to have a meeting with them without masks on, particularly if the space is well ventilated and you're able to put some distance between yourself and the unvaccinated folks. But every meeting situation is a little bit different, and I hope that advice is at least somewhat helpful.
All of your advice tonight has been very helpful. You know, this brings us to the moment in the show where we like to share our final thoughts. Sarah, let's start with you.
Well, I just want we've been giving some people some tributes and some shout outs tonight. And I just have to give a shout out to teachers because top of mind for me is my kids have been in school every day wearing masks, but in school, in person, since last August. And I will admit, when we started school, I didn't think it was going to last, but the teachers, the school personnel, everyone who keeps those buildings running, went to work and they've continued to go to work, and my kids have their last day of school next week, and I couldn't be more grateful. So I just have to give a shout out to all the educators and all the staff that help, make school districts run. And I also there was a lot of the online was a challenge for teachers too. So teachers being willing to take on that extra challenge as well is really, no matter the situation, educators tried to keep their kids top of mind this year. And I, as a parent, I'm so grateful.
You know, I'm so grateful for the farmers and ranchers who kept working throughout, even in the height of the uncertainty. They went to work. The average age of the American farmer is 58 years old, and they showed up every single day so that we could eat. And food was a big concern during the pandemic. Dr. Aronoff, who would you like to shout out?
Well, first of all, I want to shout out to my family for supporting me during this pandemic. My wife is a teacher, and I'm very thankful for her, and she was taking care of her students quite well. And I really want to give a shout out to everybody who's watching tonight, because the interest you're showing is really important. And for those of you who have already rolled up your sleeve and gotten vaccinated, that leadership is really important. So thank you very much.
Leading by example. Thank you so much for joining us. Thank you for joining us. We always appreciate you. Each and every third Thursday of the month, AARP joins us. They always bring a great giveaway with them. We'll be back on June 17th. See you then. Wishing you and your family a beautifully blessed night.